You know, there's one question I've heard over and over again throughout my years in medicine. Doctor, my blood pressure is a little high, but I feel fine. Should I really be worried? And every time someone asks me that, I'm reminded of a former patient of mine, a man in his early 40s, looked perfectly healthy, always smiling. He used to say, Doc, I'm still young. My blood pressure's just a bit high. No big deal. Until the day he was rushed into the ER with a leaking aortic aneurysm. I want you to picture this. Inside your chest and abdomen is a major highway called the aorta. Every heartbeat sends a forceful wave of blood through it. And when your diastolic pressure, that bottom number on the BP monitor, stays too high for too long, it's like slowly overinflating a balloon. A little more today, a little more tomorrow. The wall gets thinner, and one day, it bursts. I've had moments standing by a patient's bed thinking, if only we had caught this sooner. If only he hadn't brushed off that small number. So today, I want us to talk honestly as friends, as people who've lived long enough to know that health is no longer something we can deal with later. But there's something else many patients worry about, the systolic pressure, the top number. That's the pressure when your heart squeezes the hardest, like the first strong surge when you turn on a faucet. And today, the research is clear. High systolic pressure is one of the strongest warning signs for stroke and heart attack. I once held the chart of a 7-year-old patient, a man who spent his whole life working early mornings and late nights to support his family. He looked at me and said, Robert, I've been through a lot, but I don't want my heart to fail me just because I ignored a number for too many years. His words stayed with me. Have you ever felt like that? Like your body was trying to send you a message, but you were too busy to stop and listen? What many people don't realize is this. Even if you're taking medication and your numbers look good, your heart disease risk is still much higher than someone who never had high blood pressure in the first place. Studies show that a 30-year-old with hypertension has a 63% higher chance of developing coronary artery disease later in life. That number isn't meant to scare you, it's meant to remind us that medication isn't magic. Think of it as a life jacket. It keeps you afloat, but it doesn't calm the storm. After 35 years working with thousands of patients, this is what I've learned. We need to change our habits before our bodies force us to. And one of the simplest, easiest changes starts right at your dinner table. Imagine 2 glasses of salty water. One very salty, one moderately salty. If you add more fresh water to the saltier one, the saltiness goes down. Potassium in food works the same way. It balances out the sodium that most of us eat way too much of. Avocados, salmon, white beans, simple foods that help keep your blood vessels soft, flexible, resilient. Something we need more and more as we age. I have one patient, she's 72, who brings me avocados from her garden every checkup. She smiles and says, thanks to you, I eat avocado every day, and my blood pressure has finally calmed down. Moments like that mean more to me than any award. And finally, something many people in their 50 seconds, 60 seconds, and 70 seconds understand better than anyone. Our blood vessels simply aren't as elastic as they were at 20 or 30. They're like an old rubber band, they don't snap back the way they used to. That's why systolic pressure rises with age. But that doesn't mean we're powerless. The human body is incredible. It listens to you. It responds to you. Irresonantly, it percent. Move more, your vessels soften. Cut a little salt, your heart pumps easier. Sleep enough, your whole system breathes a sigh of relief. All these small changes add up to something remarkable. So I want you to sit with yourself for a moment. Take a deep breath and ask, what is my body trying to tell me today? If there's one thing decades in the clinic have taught me, it's this. People never regret taking care of themselves too early, but they always regret doing it too late. So let your blood pressure numbers be your guide, a friendly signal, not a sentence. And if today you choose to adjust even one thing, one meal, one habit, one breath, I want you to know this. You've just given yourself more healthy years to live, and you deserve every single one of them. You know, The older I get, the more I realize one thing. The human body is never truly quiet. It's always talking to us through tiny signals, subtle whispers, especially when it comes to blood pressure. But sometimes, we're the ones who don't listen. I've met so many patients who tell me, I don't feel tired, so my blood pressure can't be that bad. And then something happens, a scare, a close call, and suddenly everything becomes very real. And maybe the quietest factor of all, the one most people overlook, is sleep. Think about those nights when you're lying in bed with your eyes closed, but your mind is still racing. Ever had that happen? Your body looks still, but inside, it's like a marathon of stress hormones. When we sleep less than 7 hours a night, the sympathetic nervous system, the one that kicks in when you're in danger, stays switched on. Your blood pressure doesn't drop the way it's supposed to. One of my patients, Helen, 69, once told me, "Doctor, I thought staying up late to finish a few things was no big deal. I didn't know it was making my blood pressure climb," 18 said. And it wem, and surprisingly, once she started sleeping properly again, her numbers softened as if her body finally got room to breathe. A lot of people also ask me, "Doctor, why does my top number go up sometimes, and other times it's the bottom number? Isn't blood pressure just one single thing?" The truth is, those two numbers don't rise for the same reasons. Systolic, the top number, is often the echo of aging. As we get older, our blood vessels stiffen. They're not as flexible as they were at 20 or 30, so your heart has to push harder to move blood through those aging pipes. But diastolic, the bottom number, is a completely different story. That number reflects constant, silent pressure on your vessels even when your heart is resting. Chronically high diastolic pressure is like a small wave that never stops day after day, and it wears down your blood vessels from the inside. I always tell my patients, never underestimate either number. They're both your body speaking to you. When I was younger in my career, I thought controlling systolic pressure was enough. But the more patients I saw, especially older adults, the clearer it became that both numbers carry serious but different risks. High systolic pressure opens the door to stroke, heart attack, and silent kidney damage, the kind you don't notice until it's too late. High diastolic pressure, especially in younger people, is linked to dangerous aortic aneurysms that can rupture without warning. No number is less important. They just warn us in different ways. There's another truth that anyone in their 50 seconds, 60 seconds, or 70 seconds understands better than anyone. The body doesn't bounce back the way it used to. But that doesn't mean we're powerless. I've seen patients completely change their health trajectory with one simple thing: movement. A 72-year-old man once told me, "Doctor, I started walking just 20 minutes every morning, and my blood pressure finally came down. I even feel more alive." And he was right. Just 20-30 minutes of daily movement can unlock your blood vessels, restoring elasticity in a way no medication can fully replicate. Exercise softens the vessels like gently stretching an old rubber band. It lightens the load on your heart. It reduces strain on your kidneys, your brain, on all the organs, quietly keeping you alive. But do you know what's even more silent than sleep deprivation? Stress. Anxiety isn't a scream. It's a whisper that never stops. And every time you worry, your body releases two familiar hormones, adrenaline and cortisol. They raise your blood pressure often without you noticing. I can't tell you how many times a patient has said, "I don't eat salty foods, I exercise, I take my meds. So why is my blood pressure still high?" And then I ask, "Are you stressed about something?" And right then, tears fall. And I know the problem isn't salt. It isn't the medication. It's the weight they've been carrying inside for years. Try this. Sit still for just 3 minutes. Place a hand on your chest. Take one slow breath in and an even slower breath out. Many of my patients tell me that alone helps their internal pressure drop a notch. So before we end today, I want you to do one thing for yourself. Place your hand on your pulse. Feel each beat. That's not just your heartbeat. That's time. That's the years ahead, years you can still live fully. If you found this video helpful, stay with me for the next ones. We'll learn together how to live healthier, deeper, and longer. Not just with medication, but with a real understanding of your own body. And remember, you're not alone on this journey. I'm right here with you.